Psychology and psychotherapy explore the concept of existential crisis, where individuals are plagued with the notion of life's lack of meaning or are unsure of their personal identities. Those undergoing an existential crisis often experience distress and anxiety, hindering their daily functions and leading to depression. These attitudes echo the philosophical ideologies of existentialism. Other terms used to describe this state include existential dread, existential vacuum, existential neurosis, and alienation. Existential crises manifest themselves differently depending on the emotional, cognitive, and behavioral facets involved. Emotionally, these can incite despair, helplessness, guilt, anxiety, and loneliness. Cognitively, they raise problems of meaninglessness, personal values loss, and contemplation of mortality behaviorally. They may lead to addictions, antisocial tendencies, or compulsive habits. Understanding existential crises requires the examination of these symptoms, generally categorized based on the person's stage of life or personal development. Common types include the teenage crisis, the quarter-life crisis, the midlife crisis, and the later life crisis, all of which center around the struggle with life's purpose. Early life crises often focus on future fears, choosing life's path, education, career, and establishing personal and social identities. On the other hand, later life crises are typically characterized by reflections on life's past, regret, and fear of death. These crises align with the individual's age. However, they may not always coincide due to variation in personal development. People may go through only some of these crises or none at all. Successfully managing an earlier crisis tends to equip individuals with the tools to navigate subsequent crises. Central to all types of existential crises is the problem of meaninglessness. This can surface as cosmic meaning relating to life's purpose or personal secular meaning, which is the individual's search for self-purpose. The gap between humans longing for a purposeful life and the perceived indifference of the world enhances the issue of meaninglessness. To find meaning, individuals can opt for altruism, political or religious dedication, creativity, pleasure pursuit, self-realization, or adopting a positive mindset towards hardship. The central theme of the narrative revolves around the existential crisis, which manifests as an intense inner conflict within an individual, often characterized by the painful realization that life appears to lack meaning, leading to feelings of stress, anxiety, despair, and even depression. This can disrupt one's day-to-day life and functioning, differentiating existential crisis from other crises that are chiefly linked to external circumstances like social or economic distress. The crux of this conflict lies in the individual's longing for a meaningful existence, contrasting sharply with the perceived lack of purpose. This dire circumstance, often seen as a crisis of meaning, can be understood through the existentialist philosophy perspective. Common topics in this field include existential dread, existential despair, existential neurosis, existential sickness, anxiety, and alienation. Different authors interpret different aspects of the existential crisis. Some believe they are fundamentally crises of identity, provoking questions like, "Who am I?" and pushing individuals towards self-analysis to gain a clearer understanding of their position in the universe. Others underscore the confrontation with human limitations, such as mortality and lack of control. The term existential crisis is frequently used in psychology and psychotherapy. However, in a broader sense, it can also suggest a crisis of existence, expressing the threat to the existence of entities, be it a country, a company, or social institution due to political instability, high debt, or social shifts. Even individuals who outwardly appear successful may suffer from existential crises if their spiritual development is lacking. Various methods to combat this crisis include nihilistic approaches, cognitive behavior therapy, and the practice of social perspective taking. The most commonly used methodology involves solving this inner conflict and discovering new sources of meaning in life despite being perceived as a profoundly personal struggle. External factors can still contribute to triggering or exacerbating an existential crisis. Existential crises can be encapsulated by feelings of fear, anxiety, panic, and despair, which can often stem from an individual's struggle to find purpose in life. This emotional turmoil often morphs into being a profound sense of despair and feelings of helplessness as individuals grapple to develop a response to deal with their emotional states, leaving them feeling vulnerable to negative emotions that seemingly lay beyond their control. This emotional Distress can be attributed to past decisions the individuals consider erroneous or indicators of poor judgment. Regardless of the origin, such feelings can invoke a sense of guilt, whether associated with specific actions or just free-floating, vague guilt stirring within an individual, and is more prevalent during existential crises experienced in later stages of life and often accompanied by the fear of mortality. Existential crises also translate into disturbed personal integrity arising from a perceived absence of meaning in life coupled with lack of motivation. Close relationships with oneself and others become tainted by this negative force field, thereby inducing feelings of alienation, loneliness, and even self-abandonment. However, how pronounced these emotional aspects of an existential crisis heavily depend on the individual's personal experiences and the intensity of their crisis. Despite their unpleasant nature, they do hold the potential for positive personal development. Loneliness, in particular, might lead to individuals attaining deeper insights into the nature and importance of relationships. An existential crisis can throw into question previously cherished values, such as relationships or career success. If resolved, however, this crisis can lead to the revelation of novel insights. One particularly poignant aspect of many existential crises involves confronting the inevitability of personal mortality. Although this is a generally known fact, it becomes immensely personal and impactful when individuals face it as their immediate reality, particularly in later life or when spurred by tragic events such as the death of a loved one or a terminal diagnosis. While this realization often induces anxiety, it can also potentially facilitate overcoming an existential crisis. This is because acknowledging our limited time on Earth can instill a greater sense of value to our remaining moments and help separate vital concerns from daily distractors. Handling impending death may depend on one's religious beliefs, self-esteem, social connections, and aspirations for the future. Existential crises can significantly affect behavior, causing the individual to withdraw socially, even to the detriment of their relationships. Sometimes this crisis manifests in negative forms, such as aggression, self-harm, or in extreme cases, suicide. Addictive patterns such as drug use may also emerge as a coping mechanism intended to mitigate negative feelings or foster new insights. However, this often only provides temporary relief and may further escalate the crisis in the long term. It also risks leading to health issues such as high blood pressure, organ damage, and an increased likelihood of developing cancer. For those undergoing existential crises, differentiating between the pursuit of pleasure and power and the search for profound meaning becomes increasingly difficult, sending them down a potentially misguided path towards resolving the crisis. Lastly, existential crises can also give rise to ritualistic behaviors. The theme of the story revolves around several forms of existential crises that a person may experience as they journey through life's different stages. These crises present challenges and questions that can impact one's sense of purpose and meaning. Recognition of the variations in these crises tied to different life stages can assist in diagnosing the root cause and the appropriate solution for each crisis. It is essential to remember that although these stages are generally linked to age groups, they can differ greatly based on the individual's unique life circumstances and developmental progress. The midlife crisis is the most renowned existential crisis type, drawing much research attention. However, analysts have recognized numerous other existential crises types. Varying interpretations exist, with some discerning an early teenage crisis, sophomore crisis, adult crisis, midlife crisis, and later life crisis. Meanwhile, others concentrate mainly on the sophomore crisis, adult crisis, and the later life crisis, but define them more broadly often. The sophomore and adult crises are jointly analyzed as a dimension of the quarter-life crisis. A common consensus exists that the early life crises typically gaze towards the future, primarily associated with anxiety and uncertainty about one's life path. Conversely, the latter life crises are generally retrospective, often characterized by guilt, regret, and contemplation of mortality. It's essential to note that these crises interact and can impact subsequent crises. Unresolved issues earlier in life can compound difficulties in later crises. Nevertheless, adequately handling an early crisis does not assure successful resolution or complete avoidance of future crises. Another perspective categorizes existential crises based upon their severity. In this approach, an existential vacuum, typified by frequently recurring feelings of boredom, apathy, or emptiness, is viewed as a less severe crisis. This condition is often incurred during leisure time and does not generally disrupt everyday life, hence the term Sunday neurosis. However, if this existential vacuum manifests with overt clinical symptoms such as depression or alcoholism, it graduates into an existential neurosis, a more severe crisis level. The central theme of this passage revolves around the concept of life crises experienced by adolescents and young adults, highlighting the transformation of identity and the painful bewilderment that can stem from lack of purpose or uncertainty about one's future. With adolescence comes a craving for independence. However, without a clear-cut identity, this independence can result in feelings of displacement and potentially even depression. The essay underscores the paramount role of parents in identifying depressive signs that hint at a teenager struggling with their crisis, which can be noticed in changes in appetite, sleep patterns, academic performance, and altered social behavior. A proactive engagement with teenagers, having regular and open conversations, offers parents a chance to discern the impending crisis. The narrative further introduces two distinct life crises occurring in early adulthood, collectively referred to as the quarter-life crisis, the sophomore crisis, and the adult crisis. The sophomore crisis affects youngsters in their late teens or early 20s and is characterized by introspective questioning about life's purpose, the prospect of their future, career choices, and the formation of successful relationships. The crisis is particularly impactful on high achievers who, in spite of their accomplishments, struggle with the insecurity of not fully reaching their potential due to a lack of definitive future planning. This crisis calls for thoughtful responses to these existential queries, leading to practical commitments that guide subsequent life decisions. Some people may evade the sophomore crisis by making an early commitment to a career path, often influenced by societal expectations. However, these prematurities may culminate in a severe crisis later on if there's a significant disparity between societal preferences and personal aspirations. A phenomenon defined as identity foreclosure by James Marcia. Introduced in later adulthood, usually mid to late 20s, the adult crisis tends to encompass more intricate facets of identity that include religious preference, political orientation, and sexual orientation, amongst the previous considerations continued from the sophomore crisis. Resolution of this crisis entails self-acceptance and comfort in one's identity. The crisis symbolizes the transition into fully fledged adulthood, symbolizing completion of education, financial independence, and leaving the familial home. However, failure in resolving the adult crisis can lead to disorientation, lack of identity confidence, and possibly depression. The journey through life demands recurring adaptations to shifting external circumstances. At one stage, the person confronts the gap between inherent desires and the persona imposed by exterior forces. This leads to an abandonment of the formerly adaptive persona, a transition into a new self, and an awakening to the resultant effect. Life-altering events like job loss, affairs, partings, bereavement, or declining health can trigger a midlife crisis. This can be seen as a transitional phase where an individual is forced to acclimatize to the altered life conditions. This process requires them to rationally reassess both the immediate event and the broader shifts in age. Midlife crises are characterized by an array of symptoms like anxiety, ennui, self-questioning, compulsiveness, alterations in libido and sexuality, introspection, and insecurity. Typically, the concept of midlife crisis is associated with men. In their professions, however, it also affects women, with factors such as biological clock ticking or the advent of menopause playing crucial parts. Statistical data reveals that between 825 of Americans above 35 suffer a midlife crisis, which can be influenced by the resolution of past crises. Those who have successfully resolved prior crises manifest a higher degree of contentment with their life choices. The subsequent late life crisis generally tends to hit around the late 60s, triggered by retirement, losing a loved one, severe illness, or confronting mortality. This stage is characterized by retrospective introspection about life and its choices. This evaluation often stems from a yearning to perceive one's life as having meaningful value and an uncertainty regarding its fruition. The crisis may present as contemplation of past failures, fueled by finding ways to rectify them while time is still available, or evaluation of the individual's contribution to their immediate surroundings or the larger world. The ultimate aim usually is to leave behind an impactful legacy. However, the retrospective nature of late life crises represents less scope for resolution. particularly for those who negatively assess their life. An accentuating factor in contrast to previous crises is the lack of youthful zeal and energy required for implementing significant life changes. Some suggest that acceptance of mortality could aid in handling the crisis. Other advice promotes strategies that mitigate the crisis's negative impact rather than fully resolving it. These include maintaining sound physical, economic, and emotional health, and fostering supportive social networks. Furthermore, adequately resolving earlier life crises could be the best preventive measure against a late life crisis. The tale revolves around the struggle of finding purpose in a seemingly indifferent universe. It explores the human yearning for meaning, a desire integral to both our emotions and practicality as we pursue goals and ideals. However, the world often appears devoid of meaningful cosmic purpose, rendering the pursuit of meaning a complex endeavor. Many critics argue that in the increasingly secular world, individuals must find personal secular meanings to maintain sanity in the face of pervasive sense of meaninglessness, a paradox often referred to as the absurd in existentialist literature. This thirst for meaning often leads to existential crises, especially when one's primary source of purpose is disrupted or becomes inaccessible. This sense of doom often emerges in the absence or loss of our sources of meaning and value, such as faith, social relationships, or even thoughts about the past or future, for instance. Confronting immense suffering might shatter a religious individual's faith, depriving them of their main source of purpose. Likewise, others might tumble into an existential crisis due to looming threats like imminent death that disrupt the social order. This narrative emphasizes that our perception of life's meaningfulness is a subjective evaluation, often made in relation to our entire existence. Our search for purpose varies with different social and environmental factors, and modern society often stirs a greater sense of meaninglessness, however. Humans instinctively crave for meaning, and thus often seek accessible sources of purpose. Faith and social relationships often fulfill this quest for purpose, as established by numerous studies. The story encapsulates the eternal human quest for meaning, insisting on the importance of having accessible sources of purpose to navigate existential crises and affirm our existence. Focusing on nurturing relationships with others around us helps develop kindness and empathy, enabling one to understand their troubles and offer assistance in different ways. This spirit of goodwill could be extended towards unfamiliar people, manifesting itself through charitable contributions, for instance. Thus, the notion of effective altruism, a modern movement encouraging selfless acts and offering guidance on leading an altruistic lifestyle, is born. Altruism has been deduced as a potent source of purpose and direction in an individual's life. It impacts the individual's well-being, enhancing physical and mental health, as well as overall happiness. Pursuing a personal cause is another profound way of infusing life with meaning. The intersection between the personal cause and altruism is significant when the latter serves as the primary motivation. However, the appeal of a cause might not always spring from the urge to help others. The commitment goes beyond self, contributing towards a goal bigger than oneself. Be it religious, political, societal, scientific, or philosophical, participating actively in these causes lends substance to life. Creativity, shaping something fresh and enthralling, can be a source of fulfillment even when there seems to be no specific intention behind the creation. This element is prominently observed in the artistic sphere, where artwork is often appreciated for its intrinsic value. Many renowned artists have expressed their existential angst through their work, using it as a therapeutic outlet for their own struggles. It should be noted, though, that creativity isn't solely confined to art. It can take root in numerous areas, big or small, including science, culinary skills, gardening, writing, routine work, or even romantic relationships. Another approach to deriving meaning in life revolves around the hedonistic perspective, which believes in maximum enjoyment of life, even in the absence of a higher purpose. Hedonism is not merely about pursuing sensory pleasures, but also includes subtler forms of joy, like admiring beautiful art or engaging in intellectually stimulating conversation. It's also important to acknowledge the potential long-term impacts of such pleasures. Thus, academic circles often explore a more nuanced view of hedonism that comprises a larger range of pleasures and their long-term implications. The approach of using one's attitude to find meaning in life, particularly in challenging situations that can't be changed, is viewed as a significant source of inspiration in the face of existential crises. Often, these crises are marked by feelings of helplessness, and while the source of meaning varies greatly from person to person depending on their life stage, adopting a virtuous attitude towards their circumstances can prove beneficial. In earlier stages of life, individuals are more concerned with their own well-being and personal fulfillment. As they mature, they tend to shift their focus to altruism and the betterment of other people or causes, such as the transfer of knowledge to younger generations' existential crises. While stressful and often resulting in anxiety and strained relationships, present an opportunity for growth and change if addressed properly. On a societal level, existential crises can lead to higher divorce rates and a decrease in individuals able to contribute positively to society. However, they can also inspire individuals to address their issues, leading to personal development and an improved lifestyle. This forward-planning approach in the face of an existential crisis is seen especially during the sophomore crisis of life. It is crucial for psychotherapists to recognize the signs and ramifications of existential crises to provide an accurate diagnosis, though the symptoms can vary greatly from person to person. For some, a lack of meaning can manifest in adrenaline-fueled activities. They purposelessly dedicate themselves to causes to escape the feeling of insignificance, often referred to as defense mechanisms in some hardcore activists. This level of commitment, despite being largely devoid of care for the cause or personal safety, demonstrates a desperate attempt to alleviate the sense of aimlessness. In the harshest manifestation of crisis, an individual might display extreme aimlessness and indifference, symptoms often accompanied by depression, unmotivated and purposeless. Such a person may remain sedentary for long stretches of time, or act in a random or reckless manner without much regards to their actions. The severity of an existential crisis can indirectly be deduced from job satisfaction and relational quality. For instance, physical aggression or incessant altercations may signify an intense existential crisis. Numerous studies have proven a correlation between the absence of life's meaning and mental illness, while conversely, a sense of purpose is associated with deeply ingrained faith, clear life objectives, and personal devotion to a cause. Several methods are proposed to evaluate and address existential crisis. These diagnostic tools aid therapists in conceptualizing whether the individuals are undergoing an existential crisis, and if so, the intensity of it. Simultaneously, they provide theorists insights into the correlation of existential crisis with other existence factors like depression, gender, or poverty. Evaluation tools, like the Purpose in Life test and the Life Regard Index, focusing on life's purpose, are efficient ways to gauge this. Existential crises, due to their debilitating impact, needs effective solutions. The optimal approach is generally contingent on the nature of the crisis experienced. While some methods accentuate the need to boost intellectual capabilities to reconcile the inner turmoil, others propose external alterations. For instance, solutions for crises associated with sexual identity and self-reliance might entail finding a life partner that complements one's personality and predilection. Indicators of successful relationships involve shared interests, mutual activities, and equivalent educational backgrounds. Professional crisis, too, might potentially be handled through external means by identifying a satisfying career path. The struggle with finding purpose and meaning in life can be approached in various ways. The main perspectives include embracing uncertainty or a leap of faith, employing reasoning, or succumbing to nihilism. Other possible solutions involve methods such as isolation, anchoring, distraction, and sublimation. Also, cognitive behavioral therapy has been effective in managing existential crises by shifting the individual's thought process. The key aspect of these solutions revolves around instilling meaning into life. Three main forms of this approach have been identified. Firstly, an individual may choose a leap of faith, embracing a new belief system even without an in-depth understanding of its reliability as a purpose provider. Alternatively, one may systematically analyze all relevant elements, and thus reconstruct and validate a new belief system. The third method accepts life's inherent meaninglessness and fosters a way to cope without the illusion of purpose. A leap of faith entails committing to a belief while lacking a logical basis for it. For those experiencing existential crises, this leap involves faith in life's meaningfulness, even in absence of rational explanation. The driving force behind this approach is a strong desire for meaningful existence, which, if psychologically feasible, potentially offers the quickest passage out of existential crises. Notably, the leap of faith approach suits individuals with a more intuitive bent due to its diminished reliance on careful reflection and introspection. The strength of the faith-based belief systems lies in their resilience to empirically conflicting evidence and their flexibility to filter out disquieting data. On the other hand, those with a rational disposition tend to construct belief systems based on careful evaluations and empirical validations. This approach offers a concrete and tangible understanding of life's meaningfulness if successful. The resulting belief system, rooted in a strong empirical foundation and thorough understanding, is likely to be exceptionally resilient. The tailor-made perspective developed depends on individual values, preferences, and experiences, thus allowing the individual to focus more on what gives their life meaning. For instance, if family is determined to be the main source of purpose, the individuals may focus more on this aspect, thus leading to a lessened emphasis on other areas, like career success. The narrative revolves around the exploration of life's meaning, both on a local and global scale, and how individuals could deal with the potential conclusion of its meaninglessness. This inevitability might be difficult to accept because individuals tend to gravitate towards life purpose. Renowned thinkers like Viktor Frankl consider this inclination as the central motivational force for humans. However, this pessimistic viewpoint on life's purpose poses a significant challenge as it offers limited practical advice for individuals to navigate their lives. Even individuals who have successfully resolved existential crises following this perspective might still grapple with the purpose of their existence. On the bright side, adopting such a viewpoint can spark a sense of liberation. Detached from any preordained life goals, it also serves as a testament to honesty, by acknowledging the uncomfortable truth of life's meaninglessness against the comfort of delusion. As per Peter Wessel-Zaffe, life may fundamentally lack meaning, but it does not invariably lead to insurmountable existential dilemmas. Instead, he suggests a four-pronged approach: isolation, anchoring, distraction, and sublimation to the situation, thereby safely avoiding existential despair. Isolation involves shunning harmful thoughts, akin to medical professionals developing a detached approach to cope with the gruesome aspects of their jobs. Anchoring implies adhering to certain values and practical obligations, often seen in religious or personal devotions. Distraction is a momentary tactic to divert attention away from meaningless situations that do not contribute to our self-construction. Sublimation, the rarest among these strategies, encapsulates the transformation of life's pain into art or other creative quests. The theoretical aspects from cognitive behavioral therapy can come in handy to address these existential crises. Central to this therapy is the idea that flawed core beliefs about oneself lead to mental health problems. These beliefs can lay dormant for long spans and, when triggered, can manifest as persistently damaging thoughts, possibly resulting in depression. Such therapy heightens a person's awareness about these toxic mental patterns and the fundamental beliefs they stem from, while cultivating techniques to alter them. This could involve present moment awareness, goal establishment, role plays, or behavioral experiments. Existential crises with time may recede even when their root cause is unresolved, often being overshadowed by other issues while still subtly influencing aspects like career decision. Such a dormant crisis can lay the foundation for future occurrences and potentially complicate their resolution. It has been suggested, particularly in today's society, many existential crises go unresolved due to insufficient understanding of their nature, significance, and potential. Renowned figures such as Thomas Carlyle and Soren Kierkegaard illustrated this concept vividly. Carlyle reported how a loss of faith in God could lead to an existential crisis he categorized as the center of indifference, characterized by the individual's diminishing self-worth in a seemingly indifferent world. Kierkegaard posited that such despair emerges when established worldviews fail to address extreme life experiences. Continuing on this theme, Friedrich Nietzsche proposed that the collective loss of faith in religion and traditional morals had resulted in a broader existential crisis. The advent of modernism, CE 1890-1945, was seen as ultimately being accompanied by an existential crisis. Authorities like Emil Durkheim tied individual crises to social imbalance and a deficiency of collective norms, while others attributed existentialism to a broader crisis rooted in a loss of meaning in the modern world. The solutions proposed varied, from religious revival to individualistic existentialism, Sartre and Camus Significant inputs to the field of existential psychotherapy were made by Professor Irvin Yalom, Emeritus of Psychiatry at Stanford University, as well as Rollo May, both eminent figures in the field. Friedrich Jameson claimed that postmodernism, marked by an overabundance of visual consumer culture, has resulted in a novel social pathology replacing the traditional existential crisis. A notable aspect of existential crises is their association with modern society. The diminishing importance of cultural and religious anchors, coupled with the increasing complexity of decisions to be made, contributes to contemporary individuals' crises. For instance, an overwhelming array of career opportunities unfolds for modern students due to diverse areas of study. This increased demand for critical decision-making, compared to historical precedents like following a parent's profession, can incite anxiety and untangle an existential crisis.